All right, everybody can see the slideshow, okay? All right,
Yep.
perfect. So we're gonna go over the UH1 supplements, the accident, hospital, and critical illness. And the reason it's really important is when we look at what we do, we're not ACA agents, we're brokers. So that means that we need to do everything that we can for our clients. And ACA is going to definitely be the easiest because a lot of times those are going to be $0 premium type plans because of the subsidies are very low. But you want to make sure that you're asking questions and doing what's best for the client. So when we look at our goal, it's to provide the most complete coverage for our clients within budget, and that's if it's possible. And that's the big thing is if it's possible, because sometimes you are going to run into clients where they don't qualify for a subsidy. Sometimes you're going to run into clients that want a lot of coverage, but they're going to tell you that they don't have much that they can actually pay for it. And that's where you're going to have to ask the right questions and sometimes just explain to them that they may have to pay a little bit more than what they originally planned for. Now, the way to do this, the way to provide the most coverage and the best coverage for the clients is for one, to know your products. The next thing is ask the right questions and then find their budget. And that's probably one of the things that as new agents, people have the biggest trouble with, because a lot of times you don't want to ask people right off the bat, hey, how much money do you have set aside to pay for your health insurance? But it really is that easy. A lot of the clients are expecting you to ask that question. So you want to make sure that you're asking it on every single one of your calls, and then add the appropriate plans to fit the client's needs. And that actually circles right back to asking the right questions and then explaining how the plans work together, because sometimes if the client doesn't understand that they're two separate plans and don't understand why one plan works with another plan and how to do those types of things, they get very, very confused, and it's possible that they could end up canceling something that they actually need because they just weren't clear. All right, so know your products. So before we jump into that, I'm gonna actually jump here and talk a little bit about the uh, the portal here. So one thing, because I'm not gonna get too much into the products themselves right now, but they do have great training about it. So webinars on demand is a great place to go to get the information on the plans that we're going to go through, and you can see these, and they're just videos that go through the plan in detail. I personally went through these and I was able to really understand all the plans in just a couple of hours, and I went through every single one. The other thing that you can do is also look at the different brochures and sales tools here. And if you click that, it's also going to let you select what state it's in, and then you select what products at that point, and then it's going to give you all the brochures. And then when you're actually quoting, you can pull the brochures up as well. So there's a few different ways to do that. And really, the main reason I'm pointing that out is rather than get to a point where you're not sure what to do and then you have to ask one of us what covers what, it's a lot more efficient and effective to just get all that knowledge in the very beginning. And really, to learn all of these products probably takes a few hours if you're going through the videos and taking notes. All right, so that's that. And now, when you're going through and getting all the information, it kind of goes back to what Olivia was saying and asking before about how do you know which one to pick. At some point, you're going to have to kind of simplify things to make it easier for you to understand. And so, if that's the case with you, you want to take notes on this, because this is going to simplify all that information that you're going to get on those products. So these are actually in order of how much they cost and what the coverage is, how much they actually cover. So the first one is going to be accident wise. That one's going to be the cheapest of all four accident plans because it only covers accidents. It doesn't have any other coverage other than that. And it's less coverage if you're not hospitalized. And when you go through the brochures, what that means is if the person is in the hospital, or they pass away or lose a limb or something like that, it pays the full benefit. If not, it only pays a certain amount, and it's all laid out, and you'll see that in the brochure. With the accident expense guard, it also only covers accidents, but it covers all treatment for accidents the same. So no matter what happens, they're going to look at the bill for for treatment of that accident, and then they're going to pay out the full amount less any deductibles that are included in the plan. And then the accident pro guard, that one now covers all accidents and critical illness. and they can choose what level of critical illness that they're looking to have covered. And then the accident program, it has the most coverage as far as I'm concerned, because it does cover accidents, it does cover critical illness, and it does cover hospital admission. Now, to get into a little bit more depth on these, and then we'll jump to the next part where we're looking at what questions you need to ask to kind of figure out which one of these would work best, is if you're working with someone that all they're really worried about, especially if they're young, is going to the hospital because of an accident, and they have a high deductible or a high out of pocket maximum on their ACA plan, then the accident wise makes a lot of sense, especially if their budget's really, really low. Normally, when I'm running into kids that are around 18 to maybe 25, you'll see a lot of these because they don't really have a lot of money to spend. They may only have like 12, 13, $14, and they're looking for free insurance, but you want to make sure that if they do have an accident, they have coverage for that. The next up is the expense guard. This is when they are worried about things. I just had a client of mine that was pretty young, but he was worried about getting, cut and having to go in for stitches and things like that. So this would work well for that. And then this is for those that the Pro Guard is for those that are worried about things like critical illness, the cancer, heart attack, strokes, things like that. And they want to make sure that they have coverage for that, to not only cover the cost of, or to mainly cover those larger types of expenses. And then the Pro Gap is going to also include the hospital admission, which some people are going to be worried about, especially if they have small children, or they just want to make sure that if they do end up in the hospital because of a sickness and it's not critical, that they do have coverage for that. Any questions on that part so far? No? All right. So when it comes to questioning, this is a part of the script where we're going through the questions. The one that I use, the one that Amy uses are going to be very, very similar. And so there's a few key questions here that'll kind of help you figure out what's going to be a good fit for the client. The first one is, if you had to choose between the different types of coverage, which would you prefer? An expensive plan that covers everything, or a plan that costs less but you pay more only if something happens? Now, a lot of times they're going to be worried about what they're paying monthly and they don't want to pay that much. But this question is good because since it's giving them the two options, by adding the accident plan, you can say, okay, well, you know what? This ACA plan is really inexpensive, but you have these high deductibles and these high out of pocket maximums. This is a way where you can also pay less if something happens as well. Would you like to be able to have both? And if they say something like that, a lot of times they'll go for having the ACA plan and then having a supplement included. And then, are you more concerned about doctor visits and illnesses, or major things like cancer, heart attack, strokes, and major accidents? This will kind of tell you if the person's good for maybe the accident wise plan, or they need something with more critical illness, or if they want to make sure that they have something that covers all of the things, including hospital admission. And then, do you have anything in place to help pay the bills if you're unable to work due to a serious illness or injury? So a lot of the Allstate plans will also do this, and but with UH1 it does too. And the main reason you also want to ask this question, it gets them thinking to uh what is going to happen, not only how am I going to pay my bills, but what am I going to do about not working for a couple of weeks? What if they injure their leg and they're unable to work? Well, a lot of those plans, the UH1 ones, will pay whatever the treatment cost is regardless of any other coverage. So once their co-pays or deductibles or co-insurance, all that stuff, out of pocket maximum is met, those plans are going to still pay out regardless, and then they can use that to pay any additional bills that they have. And then currently, after bills and expenses, what do you feel you have left over at the end of the month? That's a key question, because a lot of times they don't give that any thought. And then that opens up to the next question: how much of that can you afford to put towards your health insurance coverage? Now, how doing the right thing benefits you. So we're going to be looking at a family of three, a mother and father, and we're just using these dates of birth because it's easy. They're both 35, and then a child that's 12. They have no medical conditions, and their household income is 60,000. And what they've told me is that their budget is $200. So without really going into it, because there's videos on Health Sherpa and all of that, I've already put in the information. And what we're looking at here is the UHC Bronze Value Plan. And the out-of-pocket maximum on this is going to be $9,200. And then you see the doctor's visits, $20, specialist $135, and then the drugs and the out of pocket and the deductible is 8,500. Now, with them, because it is a family, a lot of times they are going to want more coverage because they're worried about their child. And you'll see that a lot. And so, what this family is going to choose to go with is going to be the Pro Gap plan. But what we're going to look at here is this. So, let's see what the commissions look like between the two. So with the client A, the first family of three, they're only going to go with the ACA plan and that's it. So they have the bronze value plan. It's $12.46. As you know, you put in the full amount when you go into Medicare Pro, but this is what they're paying out of pocket is going to be $12.46. Now, the way it works, so let me backtrack a little bit. When I talk about commissions, all of you just keep in mind that I'm always going to go with the most conservative number there is, the lowest amount. So what you'll actually get is going to probably be bigger than this, but this is just to give an example. So with the commission, it's $15 times 3 because it's per head, and it'll be $45 a month is what you can expect to get if you do just the bronze value plan, and the total commission for the 12 months would be $540, which isn't bad. You know, this kind of plan probably takes about an hour's worth of work and you made about 540 bucks. But just including the supplement by asking the right questions and just adding that on, with the ACA plan, it's still the bronze value, so you have the 1246. The commission is going to be the same, $45 a month. But now you also have the Pro Gap, which is the 10,000, and I'll go through how to get to this in a minute. And now that's $132.57 a month. So you're still, when you combine these two costs, within that $200 budget. So you're not trying to hit the 200, you're just trying to stay within that budget. And so what that looks like is with the 6-month advance, you have the $238.62. That's going to be added on right off the bat. You'd collect that. And then you'll get an additional $39.77 after the 6 months is done. So in month 7, 8, 9, 10, 11, 12, you'll be getting an additional $39.77 on top of what you're getting for the ACA plan. And so what you're looking at as far as comparison goes is a total commission of $540 if you just did the ACA plan and didn't want to ask the questions and didn't want to give the client the best coverage possible within their budget, versus $1,017.25 if you went ahead and did what was best for your client there. And so we'll go through what that looks like as far as quoting goes. It's really, really easy. Amy kind of went through it with the dental and it's very similar. So you just click on get a quote. While it thinks. And I'm just going to do my zip code. So we have a male. I think we said it was what, 89. Okay. All right. And then we'll scroll down. And what I'm going to do here, just so that you can see the difference in cost and kind of give almost an apples to apples comparison, is I'm just going to select all 6 of these. So all the accident wise plans, because you don't get to change these. That's why they have the 3 different ones. And then I'll also make some changes to these so that they all kind of match up and you see how to do that. So you'll click view plans. All right. And so if you ever get to this point and you're not sure exactly what each plan covers, all you need to do is just click brochure and it'll give you the brochure. And the great thing about these is they also have examples too of how the plans work, and they give different scenarios. So they really do help with that. Now, as far as these goes, it looks like, you know, these accident wise plans are kind of expensive compared to these, but it's just because these aren't set right. And I'll show you what I mean by that. So with the Pro Gap, we know that it needs to be at about $10,000 as long as, you know, the client can afford it. So we'll change that coverage to 10,000. The same with the expense guard. And you see it goes all the way up to 20,000. And then with the Pro Guard too. And these you can change separately, but we're just going to leave everything at 10,000 so that it doesn't raise the price and make things kind of skewed. So as you can see with the accident wise, just the 10,000, that's the lowest of all of them. It's going to be about $46 per month. You can get 15,000 for 84 or 20,000 for 132. But again, it's only going to cover those accidents. And what we're looking at is the accident pro gap plan, because they do have the child they wanted to cover the most. And at that point, you just go add the cart. And then you can click the card up here. And then at that part, you can either do send cart to customer, which I never do. And then you can do the start broker assisted app here and then go through the questions that way. All right, so that's how that works. Now, the next thing that we're going to look at, and this is probably one of the most important things too, especially for those of you that are looking to go partner, because you want to get that, piece of the pie, you want to get that bonus. Now, what happens if you take that same example that we had, and now you've done 100 policies because you're just working consistently. And this, if you look at it over the course of 3, 4, 5, maybe months, you've now written 100 policies. What does that look like from a commission standpoint, and with what you have going towards partner to your AP, your annual premium towards your partnership bonus? So with the commission, and I should have changed this as well. This is just doing the 10, but it's $5,400. But towards partner, if you've written 1,000 policies, then it would be $337,000 would be going towards your partner bonus. And so I guess I just did the 10 here and then the 100 for the AP. So with the commission though, with 10 policies written, including the supplement, now you've pretty much doubled your income just by adding one more product to it. And you were able to get the client more coverage, and you were able to stay within budget too. And when you look at what that does towards your partnership bonus, it significantly increases that. Now it's taking it from 337,000, so you're about a third of the way there, to well over halfway there, all with just adding a simple supplement plan to the complete offering for the client. So when you look at that, what you'll really want to do, guys, is just making sure that you're doing what's in the client's best interest. I know some people or some agents will think, hey, you know what, I'm stacking things on, this isn't right. But really you have to think about what happens to that client if you don't add that coverage in. Like, let's say that they do end up in the hospital because of an accident and their bill ends up being $100,000, and now they have to pay $9,200 out of pocket, when they could have had a little bit money left over had you just added on the extra plan, which they already told you that they could afford in the beginning. So that's how the UH1 products work, and how they work in conjunction. Now, real quick, because I didn't build a slide for this, but the way I normally explain it is very, very simple. I don't really get into the weeds with the clients. Typically, what I'll say is just how I explained it to you just now. Hey, if you go into the hospital, it's because of a major accident and the bill is $100,000. Because of the major medical plan, the most you'll come out of pocket is $9,200. But with the United UH1 plan that we looked at, they're going to cover the cost up to the $10,000. So you'd be able to take that, pay for your hospital bill, and then still have a little bit money left over. Does that make sense how the two separate plans work together? And they'll usually say, okay, yeah, that makes sense because it's extremely basic. And then moving forward, they'll never have that in their head that everything is all in one plan, or see a bill coming from UH1 and then ask what this is and then potentially cancel it because they're confused. All right. So, did anybody have any questions for me?
I got a quick question. I'm
Yes.
sure this has been explained before, but it clearly went over my head. Are commissions issued like once a month, weekly, bi-weekly?
Yeah, so they're issued weekly, and it's dependent on how you're set up, whether you're an advanced setup or paid as earned setup, but it'll be weekly for the ACA stuff. When you write it and we see that the like binder's been paid on it, even if it's like a January 1 sort of advance deal, you'll go ahead and get paid on that. If it's like a UH1, sort of deal, you'll get paid the advance when, because they UH1 is very good about like there's not like long dates away. You can put it out to January 1st, but most people that get on UH1 products, it's within a few days, right? So
Oh,
that turnaround's pretty quick. And then their commission cycles actually run weekly as well. So the turnaround for getting commissions on that's pretty quick.
okay, awesome. Thank you.
What you still with that, you still want to make sure you put it into Medicare Pro
Oh yeah,
and get that policy number in there, because that's how we get it to our commission system.
gotcha.
Ian, one thing, a perspective on this, occasionally you'll have people tell you, I basically marketplace, I want great coverage, but I don't want to spend a lot of money. And the difference between a bronze plan, so the lowest cost expanded bronze plan, and a gold plan, the cost differential when it comes to how much that costs them, what they have to pay versus what they get, is in most cases way worse deal than getting a expanded bronze plan on the marketplace and then combining that with a UH1 or Allstate or whatever kind of companion plan there. Their coverage is going to be much better. The issue with gold plans in the marketplace, if you'll share your screen one more time, Ian, and if you have Health Sherpa kind of lined up, that example, if you just click the gold button there, and you can see that the plans will cost more, but they're, yeah. So all these max out of pockets around $9,000. So if you click on the gold there and see what comes up when you hit gold, it'll come up. Sometimes it'll make you sign back in. Yes. Sorry. Yeah. So if you look at that, they're going to be paying way more than they would with a companion sort of design like we're talking about, and their max out of pocket, their true financial risk is not going to be really helped at all. They're just paying more money for all the like ticky tack going to the doctor and generic drug stuff, maybe having a lower deductible. But if kind of the worst case scenario happens, they're not any more protective, and they're paying an extra $300, $350 a month to do that. Where what we can do with the bronze plan and then one of the UH1 or Allstate plans is give them a much higher level of coverage, especially if like they had to go into the hospital or something like that. They're going to come out much ahead, or even have an accident, like any of that stuff. They're going to be way better off. And so not everybody will like, some people just want the cheapest thing they can get and they'll take the risk or whatever. But this is not just how does each agent sort of maximize their time and their commissions. It's also how do you maximize the value for your client. And I think in one of the rare situations in life, everything sort of aligns here, where it's just the it's not as simple of an approach, but with the good, simple, affordable thing, this is very good and it's very affordable. You know, it's having two companies is never going to be as simple as having one. But anyway, that's my 2 cents on the matter.
Yeah, and I actually want to add to that, Brad, because I did have a client recently where they called in, they had a gold plan, and I did move them to a silver plan because, for one, they had a CSR, and I
Oh,
was
sure.
able to add on the supplement too. I did an Allstate in that particular case, but I was able to add that on too, and they got much better plan than what they had. And my assumption with a lot of the agents, and I don't want you guys to ever be like this, is they assume gold is better, and it's not. The reason that's there, and insurance companies in general think this way, is that if you want more coverage, they're going to make you pay a lot more because they assume you're going to use it more. The only reason that you would want something that's gold with these lower doctor visits and things like that is because you intend to use the plan a lot and there's something wrong with you. And so they jack the price up. That's just how insurance works. And so to kind of get around that, it's easier to do either a bronze plan or a silver plan and then just tag a supplement on top of it, and it's going to save your client a whole lot more money, and they'll have a lot more, or they'll just get a lot more bang for their buck that way.